So one of the most innovative treatments that we've been using here at Visionary Eye Doctors for the last now 7 years are called biologics. And biologics, when patients tell us that Zyge or Restasis Sequit is either uncomfortable burns, causes an allergy, or the insurance doesn't cover it, those drugs cost about $900 a month, which is crazy. So we have been using here for many years autologous serum and platelet-rich plasma, and you get it from your own blood. And so what we do is we process it, we do it in a sterile technique. We've had 0 infections. There's been no case reports in the literature with platelet-rich plasma causing an infection. But what it is just your own cells that we put in sterile bottles and you use it as a drop. And so it does heal the surface of the eye and help with symptoms. And the difference between the two is that platelet-rich plasma just has a more concentrated number of growth factors, cytokines and interleukins, which heal the surface even more. Platelet-rich plasma has been used for years now for hair loss, injection into joints. Kim Kardashian had her vampire facial, so we know it does heal cells very well. So we use it as drops, and the majority of patients, more than 90% of our patients, really do notice an improvement. It's not 100%. There's a few percentage of patients that don't improve with it, or actually can feel a little worse. That's very rare, but most patients really do get better, so we're very excited about platelet-rich plasma and autologous serum. The other biologics that we have used are things called amniotic membrane and cord blood serum drops. Amniotic membrane is basically received from the placenta of a newborn baby. So many years ago they found out that when a baby in utero in the mother's womb has surgery, the baby's born without a scar. And so you can't even tell the baby had heart surgery because the skin is completely healed. And they realized it was the amniotic membrane that healed that skin completely. So then when the baby was born and the placenta was about to be thrown away, doctors would take the amniotic membrane and we would use it for all kinds of chemical burns or patients with Stevens-Johnson's disease or terrible inflammatory problems of the eye, and it would heal the surface of the eye similarly. So we've been using it now for years for dry eye patients because it works very well to heal cells, sometimes even heal scar tissue. We use it in a surgery called pterygium surgery, so it makes it look like the patient even didn't have surgery. It's amazing what this amniotic membrane can do. So we use a product called Procara from BioTissue frequently. We also use fresh amniotic membrane, which we derive from donated placentas, that seems to have even a more significant effect in terms of its efficacy for patients with chronic eye pain. So we've used that before. We've even had patients have terrible pain on the surface of the eyelid. Unrelated, it appears to be from something in the meibomian gland, where we put the membrane on top, and it seems to help with symptoms of pain receptors as well. So it's very exciting. There is one more company called Regenerize, which crushes the amniotic membrane into drops, and that also seems to be very effective for a lot of patients. Finally, we started using cord blood serum as part of an IRB approval process for patients who have the most extreme type of dry eye symptoms and pain. And what that is a donated placenta. Cord blood is given to us, and the blood is checked for every disease that's standard. And we put it into sterile, basically bottles, and people use it as a drop. So this cord blood serum, which is essentially non-controversial embryonic stem cells, can heal the surface of the eye. So that's something that's been a real game changer in our practice, because it really helps those patients that have 10 out of 10 pain, have tried everything, and nothing has been helping. So this has provided a lot of hope to our patients.